Kia ora. I've been asked to talk to you today about how we trained our intelligent machine Zach to take the clinical notes of a consultation between a doctor and a patient. This was one of our earliest pieces of work at Omega Health because it was immediately evident from looking at research that it was essential that we had some way to reduce the amount of time that doctors spend recording information. This can amount to between a quarter and a third of the time allocated for patient care, which, whilst it's not entirely unproductive, we do need the record after all, is time that's not utilising the doctor's skills for what they're really best trained at, which is communication with the patient, empathy and diagnostics. So if we could give the doctor an extra 3 to 5 minutes with every patient, that would be really something special. Now it turns out that Zach was already trained to take the minutes of business meetings, sometimes fairly rowdy business meetings. And what is a clinical note if not a minute of what transpired between a doctor and a patient? So we started off to train Zach and were amazed by his ability. In no time at all, we trained him to take notes in SOAP format, that's subjective, what the patient said, objective, what the doctor found, assessment, what the doctor thought the findings meant, and a plan, which speaks for itself. And this is the standard format that most clinical notes follow, even if the doctors don't realise it. And it was pretty amazing stuff right from the start, so we decided we would actually study this to see if it was as good as we thought it was. And the way we did this was we got 5 sets of clinical notes that were created using only Zach listening in on the consultation. And we got 20 sets of clinical notes, 5 each from 4 different doctors. We told a panel of 15 medical students that we were doing an audit on notes quality and that we were just checking to make sure that the doctors were being as honest as they should be in terms of a notes audit, and that the students were merely checking up on that. And the students assessed each of the clinical consultations in random order against a set of criteria set by the Royal New Zealand College of General Practitioners. We were amazed by the results. We knew Zach was good, but what we didn't realise was that Zach beat all 4 of the doctors with whom he'd been compared. And these weren't inexperienced clinicians. 2 of them were fellows of the Royal College, 1 a member of the Royal College of GPs in England, and 1 a recently graduated general practice registrar who just completed communication skills and notes-taking training. So these were pretty good doctors and fairly representative of the higher end of the note-taking spectrum, and Zach still beat all of them. So that's what we can do. We can actually take away the drudgery and the burden of creating clinical notes. We can improve the quality of clinical notes because the notes Zach takes are better, and therefore free the doctor up to do more useful work. And because we're imaginative people and because we really care about patient outcomes, we also set Zach to creating a patient memo from those notes. So when Zach has listened to a clinical consultation, he knows exactly what the doctor meant, exactly what the doctor said, and is capable of creating a bullet point list of things that the patient needs to take home from those, and can also add internet resources to those from high quality selected sources. He's actually extremely good at picking quality services that are generally widely trusted. So that's what we can do in that field. It's been an amazing journey doing that. There's a much longer video online if you are interested. There's a link to that below. I hope you find that interesting. Thank you.